Hi, my name is Samantha Shear, and this is my presentation about the defunding of Planned Parenthood in Ohio. So, starting out, Planned Parenthood started as a birth control clinic in Brooklyn, New York. It was founded in 1916 by a nurse named Margaret Sanger, her sister Ethel Byrne, and an activist named Fanaya Mindell. 9 days after the clinic opened, it was raided by police and shut down, and all three of these women were jailed and arrested. Sanger used her time in prison to talk about birth control with the other women that were in there, trying to educate them and just give them more information about what it was and why she thought it was important. Sanger herself had inherently racist beliefs, meaning she believed in eugenics, like only certain people should be allowed to reproduce, which is it's deeply rooted in racism, unfortunately. And she also believed in people being sterilized without their consent. Again, a practice that's deeply rooted in racism. Despite her believing those things, her work for birth control allowed the states of New York, Connecticut, and Vermont to pass a court decision in 1936 allowing birth control to be available to women. Okay, so Planned Parenthood provides many services. Of course, they provide abortion services, but that is only a small fraction of what they do. So they also provide things like STI testing, sexual education for people that need to know more about anything having to do with their reproductive health, gender affirming care for members of the LGBTQ community who need this type of care to just feel like they can be themselves. And then birth control. They provide birth control, and oftentimes they provide free birth control for people of underserved communities, people that cannot afford it. And they also provide cancer screening, so cervical cancer, breast cancer. They provide things like mammograms. These are all important tests because these are the first steps in stopping cancer. And if detected early enough, cervical cancer and breast cancer can be treated. So if you go to Planned Parenthood's website, which I have linked here, you can find a list of clinics that are close to you, and you can find information about every service they provide, information for parents, information for teenagers, just any type of information you're looking for that has to do with sexual or reproductive health can be found on their website. So, the loss of funding from Planned Parenthood will result in marginalized communities, especially, not having access to the care that they need. So, this means people on Medicaid, people from underserved communities that don't get funding. Planned Parenthood is essential to people like that because without Planned Parenthood, they wouldn't have access to cancer screenings, to birth control, to STI testing. And all of these services are essential for women and members of the LGBTQ community to be able to survive. So, in 2025, Planned Parenthood actually had to lay off over 20 employees, and they did that so they could reserve funding for their patients to be able to continue to receive the services that they offer. So on their website, it states that if they were not to lay off their employees, over 50,000 patients would have lost access to care that they needed, which is a lot. In 2024 alone, Planned Parenthood provided the following services to Ohioans. So 156,547 tests for sexually transmitted infections, including 11,331 HIV tests. That is a lot of testing. They also provided 21,200 pregnancy tests. That does not mean that these people were seeking an abortion. Planned Parenthood also provides pregnancy confirmation. So if you if you take a test and you're not sure if it's positive or negative, you can go to Planned Parenthood and they will help you figure it out. They also provided 36,902 contraception visits for people that were seeking birth control options, 10,235 preventative care visits, including cancer screenings. These are people that are seeking out care so they won't run into things like cancer in their future. They provided 7,605 gender affirming care visits for members of the LGBTQ community. And then they also provided 10,425 telehealth visits to people that might not have access to things like cars or transportation. When family planning clinics close down, that means that people go without the care that they need. So, in a peer-reviewed journal entry that I have linked at the end of my presentation, it was discovered that longer drive times to clinics often meant that women avoided the care that they were seeking. So, with family planning clinic closures, including the closures of Planned Parenthood, women will go without care because they don't want to drive the extra time to get to a family planning clinic to be able to receive their care. This study showed that each additional 10 minutes of driving time to find a clinic resulted in an 8.9 percentage point increase in the likelihood of avoided care, which means an 8.9 percentage point increase in the likelihood that women would just not seek out the care that they need if the driving time was too long. It also resulted in a 10.4 percentage point decrease in the likelihood of mammogram receipt during the last 12 months. So women are skipping mammograms, which are essential in detecting breast cancer. It also resulted in a 12.5 percentage point decrease in the likelihood of ever receiving a clinical breast examination. So the farther away that these clinics are for people, the farther and the longer distances they have to travel to get to these clinics, the more likely they are to not get the care that they're wanting or needing. Strict abortion laws. So, in another peer-reviewed journal entry, it's revealed that in Ohio, more than 15 abortion restricting laws came into effect between the years of 2010 and 2018. In 2020, the maternal mortality rate in the United States was 23.8 in 100,000 births, which is the highest amongst all high-income countries. I don't know how to feel about that, considering the U.S. is supposed to be a place where, especially women, we're supposed to care about the women that are giving birth. We're supposed to really want women to feel like they're valued in family life and as mothers. And unfortunately, the statistics that we have aren't showing a correlation between those two things. So mortality rates also amongst Black mothers are 3 times higher than white mothers. So Black women are more likely to die during childbirth compared to white women, and that in itself speaks volumes of maternal health care in the United States. Also, no Medicaid reimbursements. So this means that people without, if family planning clinics like Planned Parenthood are not getting reimbursed from Medicaid, that means Medicaid recipients are unable to receive these services. So any person that's on Medicaid will not be able to receive any services from any family planning clinics because places like Planned Parenthood rely on getting reimbursed from Medicaid so that they can continue to provide these services to their patients. Abortion has never been a federally funded service, and therefore it will never be reimbursed by Medicaid, and Ohioans' tax dollars do not go toward abortion services. Okay, so Title X is a federal grant program that was established in 1970. This program allows for the funding of reproductive health care, preventative services, and confidential family planning services. So when Title X was established in 1970, that allows government funding for these services, for these life-saving services that women are in need of, especially in populations like that are considered minority groups, Black women especially. Title X has been something that has become something that we have to have. So, in a study conducted in 2014, including 696 patients, 61.4% went to family planning clinics for birth control, while 61.6% went for STI testing, 50.3% for pregnancy testing, and 56.6% for HIV testing. So those statistics show that women are actively seeking out these services. Members of the LGBTQ community are actively seeking out these services. Planned Parenthood is an essential part of reproductive health care because, like I said, lower funded areas where people might not normally have access to these services, this is when Planned Parenthood comes into play. Okay, so in a study conducted in 2006, it was found that Planned Parenthood was more likely to offer its patients emergency contraceptives compared to going to your primary care provider, compared to going to your OBGYN. Emergency contraceptives can be useful in cases of rape, incest, broken condoms, missed birth control pills, or no use of birth control during sexual intercourse. When used correctly, emergency contraceptives can be 99% effective at preventing an unwanted pregnancy. So, to prevent abortion services, the best way to do that is sexual education and making sure people have access to things like emergency contraceptives and birth control. My possible solutions to this problem and to make sure that Planned Parenthood stays an essential part of our healthcare system would be action from our legislators that will back bills that stop the stripping of reproductive funding. It is very important for our legislators to understand that Planned Parenthood is an essential part of reproductive health care. We could also implement state-level protections, which will ensure that a certain amount of funding will be provided to family planning clinics, including Planned Parenthood across the state of Ohio, and then donations to Planned Parenthood and other family planning clinics across the state of Ohio to ensure that their doors stay open and that they continue to provide reproductive health care to Ohioans. Those are my possible solutions. I think that the best course of action at this point would obviously be to do something at the state level to ensure that Planned Parenthood cannot be defunded. How to go about that, I'm not exactly sure. I think we need to lobby. I think women should really band together to make sure that these things don't happen. And then my 12th and 13th slide are just my references for the project. Thank you so much for watching.